Africa still lags behind the rest of the world in virtually all aspects of healthcare. For the World Health Organization, however, one area stands out as particularly worrisome. The global body has called on developing countries to invest more in diagnostics. It argues that increased proficiency in this area can ultimately lead to a stronger and more equitable healthcare system, as well as a healthier workforce. CGTN's Nick Mundimba reports.
Imagine going to a health facility near you. You meet your doctor, tell him or her your problems, like you have a headache, sporadic stomach aches, your eyes are itchy, and of course you have joint pains. And they end up writing you a prescription. They tell you to go home. According to the World Health Organization, 70% of healthcare facilities in Africa are going through this problem, which is resulting to a catastrophe, which is misdiagnosis.
Final clinical decisions depend on accurate laboratory diagnosis. Yet only 30% of healthcare facilities in Africa have the right equipment and reagents to perform even the most basic tests. The issue is worsened by socio-economic problems where the poor have to spend a disproportionate amount of their income on healthcare, which is basically money down the drain when their condition is misdiagnosed and mistreated. It all begs the question, do African governments see healthcare through the same lens as developed nations?
No. It's an investment with measurable outcomes and returns. So when you have if you have a majority of your citizens not in optimal health, then it becomes an expense, it's a cost. And the cost of a misdiagnosis is 3 to 4 times an accurate diagnosis. So the most expensive treatment is the one that is the wrong treatment.
For laboratory healthcare workers, improving laboratory and diagnostic capabilities is now an urgent need for countries in Africa, so they can become self-sufficient in their ability to counter such threats. Dr. Theo Angata is a physician who's dedicated his career to helping those who can't reach healthcare facilities for diagnosis. He provides mobile services to people's homes.
Accurate and quick diagnosis is very important. The laboratory is there to assist, and we need to have laboratories have the capacity to be able to diagnose. We also need the imaging facilities, X-rays, MRIs, CT scans, and other advanced scans like PET scans to be more available to the people. But more importantly, we also need access to primary health care. And that's what I do personally, because we are able to get the doctor to the patient's home when they need the doctor most and be able to diagnose the patient quickly and effectively.
At the 76th World Health Assembly in May, member states addressed the challenge facing them, following a recommendation from the World Health Organization Executive Board. They voted to adopt a resolution to strengthen diagnostics capacities. The resolution was wide-ranging. It covered testing for infectious and non-communicable diseases and health conditions, for pandemic prevention and preparedness, and to combat antimicrobial resistance. Artificial intelligence is now being seen as a real game changer in healthcare.
So you have a situation, we have tools in solutions in Roche where you have pathologists who are trying to diagnose, but then they have this backbone of an algorithm powered by AI that's able to then now establish that, okay, fine, my diagnosis is incorrect, that is what it is.
Analysts believe African governments must start realizing the benefits of investment in healthcare. If manufacturers on the continent can learn how to produce these diagnostic tools and healthcare workers can learn how to use them, then the days of money being wasted by the poor on misdiagnosis may be over. Nick Mundimba, CGTN, Nairobi, Kenya.